This is our shoulder flexion mobilization with a band distraction. So here we need a fixed resistance band attached at head height or slightly above, and make sure you attach the band to something stable that won't tip over when you use the band. From here on, I'm gonna loop my hand inside the band so it rests on my wrist, and then I'm gonna grab the band with my fingers and grab it tight so the band won't slip away from me when I'm doing the exercise we're about to show you. So here, I'm gonna take some big steps backwards so I feel like the band is pulling my arm into a big stretch here. First position is keeping our feet shoulder width apart and our toes pointing straight ahead. Then I'm gonna try to push my head closer to the ground than my arm. And from this position, I should be able to feel like it's stretching all the way down the side of my shoulder and my back. From here, I'm just gonna wiggle around a little bit and try to find whatever position feels the tightest. So I can change the position of my hand. I can rotate my thumb down, see how that feels, and then I can rotate my hand in some different positions here to see where it feels like I need this exercise the most. So find the most restricted position, and then we're gonna do our contract relaxes. Take a big 4-second inhale. And then I'm just gonna try to contract my right shoulder here. Hold for 4 seconds. Exhale for 8 seconds while relaxing completely. I'm gonna repeat this cycle, trying to build up more and more tension in my shoulder for every rep. What I don't want here is to bend my elbow. So remember, keep the elbow completely straight while you maintain the tension. And relax and let the band pull your arm away from yourself. Really important to think about this exercise as the band is not gonna pull your shoulder out of the socket, but your brain is gonna begin to think that that might be able to happen. So don't be surprised if the first time you're doing this exercise that you'll feel a little bit awkward and it maybe doesn't feel like you can get the complete stretch out of this position. But don't worry at all, it's perfectly normal. And for most people, it takes going through this exercise a couple of times before you really get the hang of it and tell your brain that it's actually okay to relax the shoulder completely in this position so you can really mobilize this position. The last thing I want to show you is that if you don't feel a big stretch in this position, then we can make it harder. First, of course, by walking further away, but we can also just take the leg on the same side as the side we're working and take a big step back into a lunge position. And then from here, I can really rotate deeper into the stretch and find a new restricted position. And if we're worked up to a point where this doesn't feel that tight as well, then I can make it even more difficult by taking the back leg and crossing it as far as I can behind myself and leaning into it like this. Because then I will stretch all the tissue going from the side of my ankle up towards the side of my hip, which is attached all the way up to the side of my shoulder and out into my arm. And from here, we can do the same contract relax methods as we talked about before. So this is our shoulder flexion mobilization with a band distraction.